So everybody floss. That's my first, am I right?
So much trouble with old toothache blues.
About 25% of Americans over the age of 65 have lost all their teeth. And to the credit of the dental profession, they've made many procedures to help us. We have two options. Either you pay through the mouth, as I like to say, or you lose your teeth. The National Health Statistics Group found that the amount spent on dentistry increased by 750% from 1980 to 2008. The U.S. Bureau of Labor Statistics said that from 1988 to 2008, the cost of dental care tripled. Dentistry is medicine, but in today's healthcare debate, we never hear anything about dentistry. And that's interesting. Why is dentistry left off? 50% of Americans have no dental insurance. 80% of seniors have no dental insurance. We see the costs of dentistry going up. We see the amount people are spending in dentistry going up and the earnings of dentists going up. We see dental premiums have remained largely flat, and any claim is capped. So if you need dental work, most dental policies pay $1,500 a year, and that is the maximum, which covers a few cleanings. For most people, dental insurance is not worthwhile. So ultimately, although 50% of Americans theoretically have insurance, it doesn't really cover them much. Since I hit 60, which was about 2 years ago, it seemed like my dental work was accelerating. I needed more dental work and more expensive dental work if I wanted to maintain my teeth. The dentist is showing me what I needed while I'm sitting in his dental chair, and I say, "How much is that going to cost?" And he goes, "Oh, $10,000. And it just struck me. I said, $10,000. Let's see, last time I was in the dentist chair, it cost me $12,000, which was more than my health care premium for my entire family. And of course, the difference is with the dentistry, it was $10,000 or $12,000 right out of my pocket. I come from a healthcare marketing background, and for about 25 years, I worked with major pharmaceutical companies, educating physicians and consumers on both diseases and medication. Because we live in a global economy, and today we know that people can provide the same quality service anywhere in the world because we all have access to the same information. I was in international marketing for a number of years, and I had the opportunity, if you want to call it an opportunity at some point, to be treated for various dental emergencies in other countries. And what sticks in my mind was one particular trip I had to Portugal in 2005, where I had a dental emergency. The Intercontinental Hotel recommended a dentist in town, and I went to see him with some trepidation. I went to the office. It was a beautiful office. In fact, I was impressed by the hardware he had in the office, by the equipment, because it was the first time I'd ever seen a digital X-ray machine. Never seen that in the States. The care I got from the dentist was exceptionally good. The equipment he had was great, and the cost was about 20% for this particular procedure that I would have paid back in the States. And I remember walking out going, gee, it seems to me I could take a vacation in Portugal, pay for my dentistry, and with the money I save from the dentistry, pay for my vacation. Dental tourism is where people go out of the U.S. to get dental procedures done and save a lot of money. This area is a growing area. Dental tourism accounts for about 40% of all the medical tourism, according to an article in the New York Times. And it's understandable. Most people have no insurance. Mexico is a go-to location, particularly for people in the Southwest. The downside of going to Mexico for dental care is that Mexico is having its own internal turmoil, and I think safety is an issue to go to Mexico. But if you can drive, I guess it's worth it. But we set up our company, Pan American Dental Tours, to help American patients get quality dental care, and I emphasize the word quality. Saving money is always, or should be always, secondary to getting quality care. But people can go with our services to dentists who we have personally met. We've been in their offices, we've talked to them, we've looked at their credentials, seen their equipment. We're unusual in the world of dental tourism facilitators, and the world really is mostly medical facilitators, companies that say, okay, you need a hip replacement, we'll send you here. You need cardiac surgery, we'll send you there. And oh yes, we do dentistry too. What they probably cannot do is go speak to individual dentists and build up personal relationships. So, as I always say to people in SCORE who come in for counseling, you have to have something unique in your business. Implants are probably the procedure that most dental tourists go for. And the reason is an implant per tooth in the US can run you on average between $4,000 and $6,000. In Panama, an implant will run you maybe $2,000. What I think Pan American Dental Tours can offer patients is, one, we specialize only in dentistry, and two, we're not tour guides who decided that we want to go into a growing field. We're healthcare and dental professionals. My dad, my brother, my cousin, and an uncle, before he went to medical school, was a dentist. And my sister, who's working in the business as well with me, is also from a dental background. Robin is a dental hygienist and an educator. We picked Panama for a number of reasons as a go-to location. The first is Panama has a long association with the United States. We ran the canal. The U.S. military relied on Panamanian medical and dental people to help them, and so many of the dentists there worked with the U.S. military until we left in 2000. There's a strong English language tradition there. The dentists all speak English and very well, and there's a bond to the U.S. We like Panama. It's easy to get to. The flights are not expensive. It looks like Miami. It's a beautiful, high-rise city, as would be befitting a city that makes most of its income off the canal and banking in the Latin American community. So it's a modern city, and it's a relatively safe city compared to other locations people may go for dental tourism. We like that too. It's a wonderful place if you like ecotourism. The Lonely Planet says Panama has more birds than anywhere else in the Western Hemisphere. It's got all of the ecotourism of Costa Rica, and I mention Costa Rica because many people also go to Costa Rica for dental care. In Panama, they accept the US dollar as currency. You know that feeling when you're running onto a plane at the end of a trip and you're trying to use all of the local currency because you have no use for it when you get back on the plane? In Panama, you can use your dollar anywhere. The average saving on most dental procedures will be 50 to 70% of what you might expect to pay in the States.
I'm having so much trouble with old toothache blues. Oh, doctor, I'm having